The top stories tonight and Y News. Assignment of cabinet and IATF members to areas with high rates of COVID-19 transmission questioned.
Some lawmakers in the House of Representatives withdraw their yes vote on the Better Normal bill.
The Philippines imposes a ban on chicken coming from Brazil. Opening of school year 2020-2021 moved to October.
Victoria State in Australia creates a task force to better support multicultural communities in the state.
The U.S. government wants to change the definition of showerhead for more water flow. Good evening, Philippines and the world. Today is Friday, August 14, 2020. I am Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the globe. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide to the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news, former Special Advisor to National Task Force Dr. Anthony Leachon and Senator Nancy Binay questioned the assignment of IATF members as overseers in areas with high community transmission. Rosalie Coz, our Malacanang correspondent, explains why.
Dr. Anthony Leachon expresses doubt over the Duterte administration's latest move to assign cabinet secretaries and IATF members to monitor and support local government units whose jurisdictions have recently recorded a high rate of COVID-19 community transmission. In a tweet, the former Special Advisor to National Task Force said what the LGUs need are medical experts for guidance in the execution of their plans on their COVID-19 response. This week, members of the Interagency Task Force for the Management of Emerging Infectious Diseases, who are mostly cabinet members, received their new assignment. The national government clarifies this measure is not because of the local government's inability to resolve the COVID-19 crisis, particularly in the 16 cities and one municipality in Metro Manila and the provinces of Bulacan, Cavite, Laguna, and Rizal. Senator Nancy Binay also expressed her doubts over the measure. She said it is not a well-thought-out plan. She also questions the capability of the cabinet secretaries for additional workload. But Cabinet Secretary Carlo Nograles says the cabinet and IATF members' new job assignment was inspired by the government's experience in handling the health crisis in Cebu City. According to CABSEC Nograles, the national government has achieved success after President Rodrigo Duterte designated Environment Secretary Roy Cimatu as overseer of Cebu City's COVID-19 response in recent weeks. Rosalie Coz, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, some lawmakers in the House of Representatives have withdrawn their yes vote on the Better Normal bill. One of our senior correspondents monitoring House hearings, Ray Pelayo, will tell us why.
Several members of the House of Representatives oppose a provision in the bill that prohibits mass gatherings. Section 6 of House Bill 6864, or the Better Normal of Workplace, Communities and Public Spaces Act of 2020 states that public gatherings are prohibited subject to the exemptions as may be provided under the implementing rules and regulations of the Act. The proposed legislation was approved in the lower chamber last Monday. Among the 242 Solons who voted yes were the 6 members of the Makabayan Bloc. But after reviewing the House Bill's final version, they withdrew their yes votes. One of them is Representative Carlos Zarate of Bayan Muna Party List.
Dahil tingin natin ito ay taliwas sa nakasaad sa ating konstitusyon na ginagarantiyahan ang karapatan ng mamamayan na magpahayag, i-address ang gobyerno sa kanilang mga hinaing, no? Even during the time of health crisis.
The bill primarily aims to mitigate the transmission of COVID-19 in workplaces, communities, and public places. The public should wear a face shield and face mask or an ear-loop mask if they go outdoors. Physical distancing of at least 1 meter should be observed. The Department of Education and the Commission on Higher Education tasked to formulate a flexible learning program. The bill shall improve the information and communications technology, which is much needed, especially this time of pandemic. Workplaces and industrial and commercial establishments should submit a management plan to their local government unit to ensure that safeguard measures are properly enforced. Flexible working schedules should also be implemented while maintaining the 8 hours a day or 48 hours a week work setup. Passengers of public transport are also required to use hand sanitizers or disinfectant before entering a vehicle. Violators of the provisions of the Act shall be fined with 1,000 to 100,000 pesos and may be imprisoned for 1 to 6 months depending on the offense. Ray Pelayo, UNTV News and Rescue. We serve the people. We give glory to God.
The Department of Health is investigating hospitals which do not give the rightful hazard pay to medical frontliners. Our health correspondent Aiko Miguel details why.
The Department of Health extends its condolences to the family of Maria Teresa Cruz, a nurse in a hospital in Cainta, Rizal who succumbed to COVID-19 on July 22. According to Undersecretary Maria Rosario Vergere, they have also extended help to the Cruz family.
Nalaman natin na ang niya is working in a LGU hospital. So, ang sa aming statement lang dito, no, although we have extended our we have extended yung aming pagtutulong doon sa kanila, no, sa pamilyang Cruz. Gusto lang namin na ipaalala sa lahat na susuportahan namin ng mga healthcare workers, and we welcome this kind of mga reported issues para nabibigyan natin ng solusyon.
The DOH is also finding out why Maria Teresa's hazard pay amounted only to 100 pesos, as what is being said by her daughter Joey. The standard hazard pay of medical frontliners is 500 pesos daily.
Iniimbestigahan pa namin talaga what really happened. No, humingi kami ng dokumento doon sa ospital para makita natin how they were able to compute for this hazard pay, para malaman natin kung tama ba at ayon doon sa mga meron tayo as a policy.
Even presidential spokesperson Harry Roque has stated that the Cruz family is qualified for a 1 million peso benefit in accordance with the Bayanihan to Heal as One Act, which also states that the issuance of the medical frontliners benefits must not be delayed. The DOH reminds hospitals, especially public hospitals, to not neglect their obligation to give the benefits of medical frontliners. Even LGU hospitals should give the 500 peso daily hazard pay of frontliners.
Huwag din iso-shortcut yung pagbibigay ng ating mga benepisyo. At katulad ng sabi ko nga sa inyo kanina, isinama na natin doon sa proposal natin for the Bayanihan to Heal as Act, One Act doon sa phase 2 nito, no? Yung next phase natin, itong mga additional benefits ng healthcare workers at kailangan na maipatupad. So, siguro may stricter sanctions tayo kapag ganyan para na ipapatupad ng mas maayos.
The DOH is investigating hospitals which are not giving frontliners their hazard pay. Nurse Maria Teresa's story raises awareness that the life of medical frontliners, who are one of our modern-day heroes, cannot be priced with any monetary value. Aiko Miguel, UNTV News and Rescue. We serve the people. We give glory to God.
Contact tracing in some business establishments goes digital. The developers of a new contact tracing app assures businesses that they have nothing to worry about data privacy. One of our senior correspondents, Joan Nano, will tell us why live. Yes, Joan.
Harleen, for a faster and easier way of contact tracing for possible exposure to a COVID-19 patient, Filipino tech developers launched today the Safe Pass. The digital incident mitigation and management solution is developed by Talino Venture Labs, Amihan Global Strategies, and Unawa, which is designed to make it easier for everyone to practice COVID-19 contact tracing and safety protocols. Through a smartphone, a user may visit www.safepass.asia. Here, the users can register their business or office. Just follow the instruction and provide some details which are essential for contact tracing. They can register all their employees who are allowed to enter their workplace or office, as well as the number of customers or clients permitted to get in and out of the establishment. SafePass is also feature a scanning capability. A QR code is generated for anyone who enters the building or office. The Department of Tourism and the Department of Trade and Industry have partners with Talino Venture Labs in order to use SafePass in different offices and business establishments for free. Tourism Secretary Berna Romulo Puyat acknowledges the use of SafePass so they could immediately trace people who might get exposed to a person who is COVID-19 positive. Talino Venture Lab CEO Winston Damarillo assured that data privacy will not be compromised when using SafePass.
So it's the owner of the controller of the data talaga is yung establishment or yung office or yung tindahan, no. So that's the owner of the data. Hindi po kami, hindi sa SafePass, hindi po ang gobyerno, hindi only at the time where we need it, it's accessible. Pero on the day-to-day, hindi po kayo tinatrack, hindi po kayo sinusloop. Ito po ay para lamang na tayo ay mag-clear na pumasok, lumabas ka sa isang facility. At after the period of contact trace, binubura po yung data. That's between 21 and 42 days. Yes.
For now, the developer is offering the use of SafePass for free, and any business establishment can readily use it at this point. Harleen?
John, I just want to ask, is SafePass used only for business establishments or buildings, or does it have other purposes?
Harleen, aside from offices and business establishments, the Filipino developers are also looking into other areas or sectors that where SafePass could be used. For instance, public transportation and other places where people mix and where the transmission of the virus is highly possible. Harleen?
Well, now contact tracing in the Philippines goes digital. Thank you so much, Joan Nano, for that report.
Meanwhile, the country's Department of Health says that 6,260 new cases were reported today based on tests done by 98 out of 103 laboratories. The National Capital Region, or NCR, reported the most new cases with almost 4,000, followed by Laguna with more than 300 additional positives. Now, the total confirmed cases of coronavirus infection in the Philippines surpasses 153,000. The active cases have reached almost 80,000, with 91.1 of those patients in mild condition. We have lost 16 more patients, but through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, over 1,000 more people have won their battle against the invisible enemy. That brings total recoveries nationwide to 71,405. Thanks be to God.
Let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of close to 21 million confirmed cases in 188 countries, regions, and sovereignty. The fast-spreading disease has claimed more than 759,000 lives, while over 13 million patients across the globe have recovered from the new coronavirus infection. Thanks be to God.
The Philippines imposes a ban on chicken coming from Brazil, while the Department of Agriculture assures the chicken meat now in local public markets are safe to eat. Ray Pelayo explains why.
Amid reports of Chinese authorities that a batch of chicken wings imported from Brazil have tested positive for the novel coronavirus, the Department of Agriculture imposes a temporary ban on the importation of chicken from Brazil. The South American country has the second highest caseload of COVID-19. The Philippines Agriculture Department says this move will serve as a precautionary measure. It assures the public that strict border anti-coronavirus measures are in place when it comes to the movement of imported goods.
So hindi lang po COVID, lahat ng hindi dapat pumasok po dito na magiging threat sa atin, human, animal, or anything ay hindi po dapat papasok.
Brazil is the third largest exporter of chicken to the Philippines so far this year, with more than 55 million kilograms from January to July 2020. DA assures the chicken meat in the local public markets are safe to eat. DA requires the workers engaged in meat establishments, poultry dressing plants, slaughterhouses, and meat processing plants to report to the health department any unusual sickness. Also, the Bureau of Fisheries and Aquatic Resources advises the public to observe proper food handling after reports of seafoods in Kalapan City, China also tested positive for SARS-CoV-2. According to BFAR, fresh foods must be washed and cooked thoroughly. The World Health Organization has stated there is no evidence at this point of food-to-human transmission of COVID-19. Ray Pilayo, UNTV News and Rescue. We serve the people. We give glory to God.
Meanwhile, an advisory to Kalapan City, Mindoro, all courts in the city are physically closed until August 26, 2020. This comes after Kalapan City was placed under Modified Enhanced Community Quarantine or MECQ from August 13 to the 26th. According to a memorandum from the Office of the Executive Judge, Kalapan City courts may be reached only through their respective hotlines and email addresses. No personal follow-up walk-in requests shall be entertained. All pleadings shall be filed electronically, although all courts shall assign a skeleton workforce. Court personnel who will report to work physically are required to observe health protocols at all times.
To parents and students, you have all been preparing for the August 24 school reopening. But classes will begin not this month, but in October. Dante Amento will tell us why.
The reopening of classes will not proceed this coming August 24. Based on the Education Secretary's announcement this afternoon, classes won't begin until October 5th. Secretary Leonor Briones said that President Rodrigo Duterte has approved her recommendation to defer the school year opening. The recommendation from Secretary Briones comes after the National Capital Region and Laguna, which have the most enrollees, which account for more than 6 million, were placed under Modified Enhanced Community Quarantine. The DepEd chief asked to defer the start of classes due to the lack of preparations in the NCR and Laguna because of limited movement of DepEd personnel caused by strict community quarantine protocols.
Sa preparation ng mga materials, talagang nagkaroon ng logistical challenges because of the limitations of movement ng mga tao natin, and also the fact that we have to organize skeleton forces.
Briones clarified she had been stressing that classes would begin on August 24 during the previous days because it is in the law. Section 3 of Republic Act 7797 states that the school year shall start on the first Monday of June, but not later than the last day of August. But just recently, President Duterte signed a new law allowing to reschedule the opening of classes beyond August amid the ongoing pandemic upon the recommendation of the Education Secretary. Private schools which are affiliated with higher education institutions or universities and colleges are not included in the adjustment of the class reopening. Briones added they will not prevent private schools that have already begun their classes as long as they comply with the health protocols the government is implementing to combat COVID-19 transmission.
Sayang naman kung titigilan natin sila. Ang medyo sabay-sabay, yung hindi pa nakaumpisa at saka yung talagang pangmalakihan na kailangang ayusin ng husto.
DepEd advises teachers to continue their simulations, trainings, and other necessary preparations such as the printing of modules. Parents and students, on the other hand, may continue participating in dry runs or simulations to prepare for when October comes. DepEd admits several adjustments need to be done, like the assessment or periodical examinations of the students and when school year 2020-2021 will end. Dante Amento, UNTV News and Rescue. We serve the people. We give glory to God.
Some senators welcomed the decision of embattled Philippine Health Insurance Corporation, or PhilHealth, to temporarily suspend its interim reimbursement mechanism, or IRM. The agency, in its statement, said it suspended the IRM to review its overall implementation and resolve issues arising from the congressional hearings. It also maintained that the IRM is legal and necessary for the country's overall COVID-19 response. Despite this, PhilHealth assured the suspension will not affect other member benefits, including the regular COVID-19 inpatient benefits, testing, and community isolation packages. The IRM is a measure applied by PhilHealth to provide emergency funds to healthcare institutions during unforeseen events like the COVID-19 pandemic. However, lawmakers question the multi-million releases from the IRM fund to dialysis centers and maternity care package providers that do not cater to COVID-19 patients. Senators also revealed that there are COVID-19 referral centers that have yet to receive reimbursements from PhilHealth. For Senate Majority Leader Miguel Zubiri, the IRM suspension is a good first step towards transparency in PhilHealth. According to Zubiri, it will further allow the Commission on Audit and the Office of the Ombudsman to monitor and account for the earlier fund releases, noting that only 1 billion pesos were liquidated out of the 14 billion pesos already released by PhilHealth to various healthcare facilities. Meanwhile, Senator Kiko Pangilinan believes the move should have been done earlier, but still welcomed the suspension to address what he described as leakages in the reimbursement system of the agency. Senator Risa Hontiveros shared the same sentiment, noting that the liquidation and audit should be completed before the IRM can be implemented again.
Kailangan maaga itong maresolba, also through the proper and complete submission of liquidation nung mga ospital o health facilities na nakatanggap na mula sa IRM para makita po ng mga magli-liquidate, mag-audit nito na nasa tama na yung accounting tungkol sa pera ng IRM bago ito maipatakbo muli.
On the other hand, the lady senator also denied allegations linking her to the corruption inside the agency, calling it fake news and diversionary tactics. Some netizens claim that Hontiveros has something to do with the missing funds during her stint as a member of PhilHealth's board of directors in 2015.
News diversionary tactic lang ang ginagawa nila. Siguro kasi malakas akong kritiko ng presidente at wala naman silang ibang maibato sa akin kasi mismo ang PhilHealth at COA mismo ang nag-clear sa akin, ay ito na lang yung paulit-ulit na binabato nila sa akin.
Hontiveros hopes Health Secretary Francisco Duque III will attend the Senate hearing on the allegations of corruption in PhilHealth next week and answer all the questions on the controversies. Senators who have called for the postponement of the August 24 school opening welcomed the decision to move the start of school year 2020 to 2021 to October 5. Senate Committee on Basic Education Chairperson Senator Sherwin Gatchalian says the decision to move the start of the school year is the most prudent course of action amid the surging number of COVID-19 cases in the country. According to the senator, it is crucial that preparations continue to fine-tune all aspects of the distance learning, which include the completion of self-learning modules and improving the radio and television-based programs. He also called on the department to give teachers assurance in terms of their welfare and safety, especially if they contract COVID-19. Senators Francis Tolentino and Christopher Bongo both thanked President Duterte and Education Secretary Leonor Briones for heeding the call, saying this will address issues and needs of teachers, parents, and learners in preparation for the distance learning.
Meanwhile, the One Hospital Command Center emphasizes the need for patients to be initially checked in barangay health centers. Let's find out why from Asher Kalapan Jr.
Since the One Hospital Command Center or OHCC was opened on August 6, more than 500 patients have received assistance through about 100 calls to the facility per day. The OHCC mainly helps COVID-19 patients find a corresponding health facility, while almost all hospitals in Metro Manila are overwhelmed. But according to OHCC head Michael Salalima, patients should first have their symptoms checked by doctors in their respective barangay health centers. This is to ensure that their sickness will be attended to accordingly in the appropriate facility.
Iba't iba naman po ang antas ng tinatawag nating sintomas patungkol sa COVID. Minsan pa nga sir, yung sintomas, we are not sure kung COVID positive po ito or hindi naman po positive dahil hindi pa ho nasa swab. Pero ganun pa man ang una po talagang by default and DOH protocol ay we can approach or we can call our barangay doctors.
Immediately identifying whether patients should be referred to an isolation center will avoid overwhelming hospitals with patients that may instead be taken care of in a more conducive facility. It would also allow for maximizing hospital facilities for moderate to severe COVID-19 cases.
Pag may mga ganito po kaming kaso na mild or asymptomatic cases na dumarating po sa aming ospital, diretso na rin naman po kaming nakikikoordinate sa One Hospital Command Center para po malipat sila sa mga mas komportable o mas maluwag na mga quarantine facilities. Marami rin po kasing naka-confine na medyo nasa mild cases lang po, na sana po ay hindi na rin po natin mailagay sa ospital yon at ma-manage na lang sa mga local isolation facilities or sa government facilities na meron din pong mga doctors na nakapantay po.
Patients diagnosed with COVID-19 may contact the COVID-19 Command Center through its telephone numbers or via the Pure Citizens app, which is downloadable for free through a smartphone. Asher Kalapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Departments of Health and the Interior and Local Government launched a new campaign to fight the spread of COVID-19 in the country. This entails everyone's cooperation and discipline. Vincent Arboleda will tell us why.
The national government wants the minimum health standards approved by the DOH to become part of the Filipinos' new lifestyle. That is, in order to control the spread of COVID-19 in the country. A person's behavior and discipline play a big role in accomplishing this goal. For instance, Interior Undersecretary cited there were individuals who had undergone swab testing but did not follow quarantine protocols and instead went partying or going to several places even before receiving the result of their test.
Kung tumataas po ang numero ng kaso, hindi po yan kasalanan lamang ng gobyerno. Yan po ay problema nating lahat. Kasi bawat tao po ay may responsibilidad dito. So importante po yung tinatawag nating individual discipline and individual responsibility.
Malaya says this behavior needs to change and that discipline is key to this. That is why the Department of the Interior and Local Government and the Department of Health launched a new behavioral campaign, Bida ang May Disiplina, Solusyon sa COVID-19. Bida is an acronym for the Health Department's health protocol for every individual, such as wearing a face mask, frequent hand washing or sanitation, physical distancing, and knowing true information on COVID-19. The government also launched Barangay Disiplina Brigades to make sure that the health protocols are followed in the communities. Meanwhile, the Marikina City government will implement a localized lockdown on select areas, specifically clusters of houses, retail stores, groceries, and public markets in 3 barangays. These are Santo Niño, Malanday, and Concepcion 1, the barangays in Marikina with the 3 highest numbers of COVID-19 active cases. Contact tracing, massive disinfection, and sanitation will also be done in these areas where COVID-19 cases have been recorded. Aside from this, the city government of Marikina has passed a law providing alternative penalties to quarantine protocol violators.
Halimbawa, wala kang pambayad ng multa, wala kang perang maibigay kasi mahirap ang buhay, pwede kang mag-community service.
Mayor Marcy Teodoro hopes that with these actions, the incidence of COVID-19 transmission in the city would decrease. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
Now, here's a glimpse of what's the weather like in parts of the country. A low-pressure area is expected to bring scattered rains over Batanes. State Weather Bureau Pagasa says as of 3 p.m. today, the LPA was spotted 170 kilometers north-northeast of Basco, Batanes. This will bring cloudy skies with scattered rain showers and thunderstorms over Batanes and Babuyan Group of Islands. Meanwhile, the Intertropical Convergence Zone, or ITCZ, will bring cloudy skies with scattered rain showers and thunderstorms over Bicol region, Eastern Visayas, Marinduque, Romblon, and Mindoro provinces. Metro Manila and the rest of the country will experience partly cloudy to cloudy skies with isolated rain showers due to the ITCZ or localized thunderstorms. Possible flash floods or landslides may occur during severe thunderstorms. No tropical cyclone advisory is issued.
The Health Department is not hindering local governments to procure Remdesivir for COVID-19 cases. But according to the DOH, they have to seek compassionate special permits from RHFDA for individuals' use. Aiko Miguel tells us why.
The Armed Forces of the Philippines believes that the arrest of Abu Sayyaf leader Abdul Jihad Edang.
Yesterday, the Manila City government announced that they bought 2,000 vials of COVID-19 trial drug Remdesivir. The Manila LGU procured it at 6,500 pesos each from 20,000 pesos, costing them 13 million pesos for the purchase of the Remdesivir vials. According to Mayor Isko, they are also ready to procure more if needed. On the other hand, according to the DOH, although Remdesivir is still under a solidarity trial, LGUs are free to purchase such drug, but LGUs will have to follow protocols.
Ginagamit lang ang Remdesivir sa ospital, unang-una. Pangalawa, dapat guided by a physician. Pangatlo, ang magre-request ang doktor. Hindi po tayo basta sparingly magbibigay niyaan. At dadaan regulatory process. So ang process natin ngayon, kapag ginamit ang Remdesivir outside of the clinical trial that we have right now, kailangan may compassionate special permit. So kailangan per individual ang gamit niyan.
Those who will be using Remdesivir should seek for a compassionate special permit from the Food and Drug Administration when doctors administer it on patients.
So halimbawa, si patient A mangangailangan doon sa kanilang naka-hospital siya. Yung doktor niya magre-request for a compassionate special permit sa FDA. Mabilis lang to ginagawa ng FDA ngayon. Bibigyan siya ng clearance ng FDA. Doon sa kanyang isasubmit sa FDA, may informed consent dapat na sinubmit para sa pasyente. So yun yung mag-work na regulatory process for those who's going to use Remdesivir outside of this clinical trial.
According to the DOH, Remdesivir cannot be bought in drugstores and can only be administered in hospitals.
Pag gumagamit tayo with compassionate special permit, isa sa conditions dyan, magre-report kayo sa FDA ng any adverse effects na nangyari sa pasyente sa paggamit nitong Remdesivir o kung anumang off-label drugs na ginagamit ngayon outside of the clinical trial.
The DOH also emphasized that there is no proven cure or treatment yet for COVID-19. Experts are still evaluating potential vaccines and drugs for COVID-19. The FDA warns the public not to patronize drugs offered online and other stores which claim to be a cure for COVID-19. Aiko Miguel, UNTV, News and Rescue. We serve the people. We give glory to God.
The Armed Forces of the Philippines and the Philippine National Police are ready for the possible retaliatory attack of the Abu Sayyaf group. Our police correspondent, Leia Ilagan, tells us why.
The Armed Forces of the Philippines believes that the arrest of Abu Sayyaf leader Abdul Jihad Edang Susukan is a big blow to the Abu Sayyaf group. Because of this, the leaderships of both the AFP and the PNP have alerted their personnel in Mindanao for a possible retaliatory attack of Susukan supporters.
Handa ang Sandatang Lakas ng Pilipinas upang supilin, pigilin at hadlangan ang anumang masama nilang pinaplano. Sa mga pangyayaring katulad nito ay alam natin na maaaring meron siyang makasamahan na magtatangkang gumawa ng kaguluhan o karahasan, subalit hindi yan natin paihintulutan at hahadlangan natin yan. Lahat ng ating mga tropa ay nakahanda sa bagay na yan.
According to PNP spokesperson, Police Brigadier General Bernard Panak, Susukan's arrest will bring justice to all his victims.
Kaya ang pagkaka-aresto dito kay Idang Susukan ay magbibigay hustisya sa mga naging biktima na kinasasangkutan nito ng mga karahasan.
Last night, Susukan was arrested in a residence of Moro National Liberation Front or MNLF Chairman Nur Miswari in Barangay Maa, Davao.
Doon namin siya yung warrant of arrest sa bahay ni Nur Miswari. We want to avoid yung mga worst case scenario ba. There was negotiation na binibigay na rin sa police.
Susukan has undergone booking procedures and medical examination, including a swab test. The ASG leader is said to have sought medical attention in Davao, but he was monitored by the PNP Davao Intelligence Group. The PNP is set to turn over Susukan to AFP Chief of Staff Lieutenant General Gilbert Gapay Jr. in Davao for security purposes. Susukan will also be brought to the Court of Origin in the Regional Trial Court 9th Judicial Region in Jolo, where authorities will return the arrest warrants. Susukan faced 34 warrants of arrest for 23 murder charges, 5 kidnapping and serious illegal detention cases, and 6 frustrated murder charges. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
And for the news abroad, here's Maria Latosa live from Perth, Australia. Good evening, Marielle. What have you got for us tonight?
William, today Victoria Premier Daniel Andrews announced additional funding to reach out to more culturally and linguistically diverse Victorians. Also, I will tell you why France has been added to the list of UK's quarantine countries. And our fellow from the USA will tell us why the US Department of Energy proposes to ease shower rules.
Go ahead, Marielle. Please tell us why.
To better support multicultural communities during the coronavirus crisis, the Victoria State Government will establish a cultural and linguistically diverse communities task force. Premier Daniel Andrews on Thursday announced an additional 14.3 million Australian dollar funding to reach out to more culturally and linguistically diverse Victorians and ensure they get the support they need when they need it. It will also ensure to avoid further translation errors of key health messages after basic language errors and discrepancies were uncovered in state and federal government coronavirus messaging. Multicultural Affairs Minister Ross Penn said working together is vital to get on the top of the pandemic situation, which includes looking after Victorians facing language barrier and access to services challenges. Aside from establishing the CULD Communities Task Force, the fund will also be utilized to provide support for organizations providing culturally specific emergency relief and expanding distribution of vital health advice. Contact tracers will also get additional cultural training. According to Federal Health Minister Greg Hunt, in order to avoid future errors, the federal government has already spent $1 million Australian dollars to check materials once posted online. There have been constant process of checking and mechanisms to ensure the risk of errors is minimized, and said an online message identified as poorly translated was actually correct, but an error occurred when it was uploaded. Several parties emphasized that accurate translations are crucial, as translation errors undermine Australia's response to the pandemic and erodes the authority of the information. Premier Andrews said on Thursday the errors earlier seen have already been corrected. Travelers to the United Kingdom coming from France, Malta, and the Netherlands will be forced to quarantine for 14 days starting tomorrow. According to Secretary of State for Transport Grant Shapps, if you arrive in the UK after 4 a.m. Saturday from these destinations, you will need to self-isolate for 14 days. The UK's government decision follows a surge in cases in the countries affected in recent days. But Clement Billon, France's Secretary of State for European Affairs, tweeted that the UK's decision was a matter of regret for the French. The UK's move comes amid a rising number of COVID-19 cases in France, which is the second most popular holiday destination for UK tourists after Spain. Monaco, the Turks and Caicos Islands, and Aruba are further additions to the quarantine countries as well. The new measure applies UK-wide, so all four parts of the United Kingdom, Scotland, Northern Ireland, Wales, and England, according to Secretary Shapps. Meanwhile, 7 African countries will begin to conduct coronavirus antibody tests next week. That is according to Africa Centers for Disease Control and Prevention says the testing is part of the effort to understand how widespread coronavirus infection is on the continent. The CDC had said the continent had conducted 9.4 million coronavirus tests so far, which is close to the 10 million target. Let us now take a closer look at the updated count of coronavirus cases in countries worst hit by the pandemic. The USA accounts for more than 5.2 million of the global case count of close to 21 million, with death toll surpassing 167,000 sadly. Brazil, on the other hand, has over 3.2 million case count as of today, although with more than 2.5 million patients have recovered in the South American country. Cases surpassed 2.4 million in India, while its total deaths from COVID-19 reached 48,040. Russia's cases are nearing 911,000, though it has approved a COVID-19 vaccine called Sputnik V. South Africa continues to struggle with over 572,000 cases, although stepping up its testing efforts. These are the top 5 countries worst hit by the pandemic. The U.S. government wants to change the definition of showerhead for more water flow. Joining us tonight is one of our correspondents in the USA, Marie Peñaranda, to tell us why live. Marie, why are they calling for such change?
Yes, Marielle, after U.S. President Donald Trump's complaints that he is not getting wet enough, the U.S. government proposes changing the meaning of showerhead to increase water flow. Well, the American chief executive said he wants to keep his hair perfect. This is what he said in the White House in July.
As you take a shower, the water doesn't come out. You want to wash your hands, the water doesn't come out. So what do? You just stand there longer, or you take a shower longer? Because my hair, I don't know about you, but it has to be perfect. Perfect.
The Trump administration, through the Department of Energy, wants to have each nozzle to spray as much as 9.5 liters, not just the overall shower heads. Under a 1992 federal law, shower heads should not pour more than 9.5 liters of water per minute. Under the Obama administration, if there are 4 nozzles, no more than 9.5 liters should come out from all 4. The DOE had published a Federal Register notice of proposed rulemaking pertaining to test procedure for shower heads. But consumer and conservation groups said the Department of Energy's proposal following Trump's complaints is wasteful and unnecessary. Marielle?
Marie, please tell us what are the comments of some consumer and conservation groups on the showerhead issue?
Yes, well, the executive director of the Appliance Standards Awareness Project, Andrew Delasky, says the shower gimmick would not only raise costs, but also raise greenhouse gas emissions. For him, also, it is an absurd use of DOE's time, and it's not going to help the country's water reservoirs. While on the other hand, for David Friedman, Vice President for Advocacy of the Consumer Reports, there is absolutely no need to change current showerhead standards. And he also added that thanks to the standards, consumers have access to showers or showerheads that not only score well on CR tests and achieve high levels of consumer satisfaction, but also save consumers money by reducing energy and water consumption. Marielle?
Thank you, Marie, for that report, and we will be waiting for updates from you in the future about the developments of the proposal on shower heads. And those are the reasons behind the news here in Australia and in other parts of the globe. Back to you, William.
Thank you, Marielle. Stay safe there in Australia.
The development of light-responsive materials has captured scientific attention and advanced the development of wirelessly driven terrestrial soft robots. Now, researchers at the University of Warwick in the United Kingdom find the significance of artificial aquatic polyps even in medical analysis. Jovic Bermas tells us why.
Like a coral polyp, this artificial aquatic polyp developed by scientists from the Warwick Manufacturing Group or WMG at the University of Warwick is able to remove contaminants or dirt from water. Eindhoven University of Technology in the Netherlands leads the group. This 1 centimeter by 1 centimeter wireless artificial polyp moves under the influence of a rotating magnetic field beneath the device, which drives a rotating motion of the artificial polyp's stem. The motion then generates an attractive flow for suspended targets, such as oil droplets, towards the artificial polyp. Once within reach, an ultraviolet light will then be used to trigger the polyp's tentacles and bend towards the light, enclosing the passing target within the polyp's grasp. The target can be released through illumination with blue light. To help understand and explain the robot's mechanism, Dr. Harkamal Jot Kandail from WMG University of Warwick developed a state-of-the-art 3D simulations of the artificial polyps to optimize the tentacles for efficient grabbing of the floating particles. Dr. Kandail commented that corals are such a valuable ecosystem in our oceans and hoped that these artificial aquatic polyps can be further developed to collect contaminant particles in real applications. Apart from collecting water contaminants, this soft robot is also expected to be useful in medical diagnostic devices as it can pick up and transport specific cells for analysis. Jovic Bermas, UNTV News and Rescue. We serve the people. We give glory to God.
Refugees from Syria, Afghanistan, Myanmar, and other countries under the care of the United Nations High Commissioner for Refugees, or UNHCR, have crafted face masks. Although the face covers are not intended to act as a medical device or other medical product, according to Made 51. The refugees' mask creations are sold through Made 51, and profits will benefit the United Nations High Commissioner Commissioner for Refugees Programs around the world. According to UN Deputy High Commissioner for Refugees Kelly Clements, rather than viewing millions of refugees across the globe as a burden, MAID 51 sees their talents and potentials, which if unlocked, could be beneficial to displaced men, women, and children. And those are the reasons behind the news, August 14, 2020. I am Jorlene Delgado. We serve the people. We give glory to God.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
And I am William Theo. Because we need to know, we will always ask why. Have a great evening.